Hello everyone, my name is Erica Salas and today I will be presenting the teaching and learning strategy of critical incident analysis. Critical incident analysis was first created as a method for understanding pilot errors and was also used to research safety and anesthesia. Now, as a teaching strategy, critical incident analysis is a method of reflective learning, and students are asked to recall and describe a critical incident and then reflect and analyze this incident in order to identify any type of learning or education that came from the actual experience of the incident and then the reflection and analysis. This learning can come from both positive and negative incidences, so they don't just have to be negative in nature because we can all learn things from positive experiences as well. In this video, I'm choosing to present critical incident analysis in a setting that we have all experienced, which is a job interview. My targeted audience for this video will be soon-to-be graduating nurses who will be interviewing for their first jobs. Although really any person who is interviewing for any job can benefit from this teaching. At the end of this video, the target audience will be able to list the steps of critical incident analysis, and the target audience will be able to describe how critical incident analysis can be used to help practice and prepare for job interviews. In almost any job interview, the interviewer will like to assess how someone responds to both negative and positive situations and if the applicant really learned anything from their experience. Applicants will usually be asked to describe a stressful or negative situation experienced in a previous job, or as in our target audience, a previous clinical situation. Being able to use critical incident analysis in this type of situation will allow any job applicant to successfully maneuver and answer these types of questions effectively. And now I present critical incident analysis.
Sanders, I'd like to thank you for coming and interviewing with us today and ask you a couple questions.
Okay.
Can you tell me a critical incident that you've encountered in a previous job?
Well, in my previous job, I've encountered many critical incidences. I've experienced a lot of patient death and dealing with the family, and a lot of times it's and one of the maybe rougher times was very traumatic, very unexpected death, multiple deaths in a car wreck, sisters. And the four sisters and all four sisters passed away. One of them made it to the hospital, and it was the whole way she got her injury and everything was very devastating to the staff as well as to the family. And there were a lot of family members, and we had three other. It's a pod situation where we have four patients in a room, and it's 2 o'clock in the morning. So I had to let the chaplain know that I could not have over expression of grief, and I let the chaplain know what my expectation was and what I needed to happen. And he was very he was a very good manager of the family and getting it in so that we could meet the family's needs as best we could, and we could also meet the other patient needs, and it worked out extremely well. I just let him know what I needed, and then he followed through with that, and I kind of helped him shepherd the family, and it worked out very well.
What do you think and feel about what you were doing at the time?
Well, at the time, I was. It was mostly. There's not a lot of things that you can do for the patient. Your focus shifts from the patient, because they are for the most part, they're just still cardiac alive. So your focus shifts on how to get the family from coming in knowing things are bad, realizing their worst fears, and then getting them so that they can move on to the next point. So I was thinking about a lot of things, trying not to think about my own things that were going on, because I could think about that later. But meeting the family's needs was the most important, and so that's where I put my emphasis.
And as you look back, what do you think and feel about the outcome?
The outcome, I think, was very well because we had such good teamwork. The chaplain responded to what I told him I needed. The charge nurse worked to help keep the other patient, my partner and the charge nurse kept all 3 other patients well taken care of while I was dealing with this very, very sad situation. And so I was very proud of working with a team that was that strong and could get that done in the fashion that we did.
What did you learn about yourself, any relationships with others, organizational policies and procedures?
I learned, I think that I learned that there really is a time where you need to realize that there are also things that you need from a situation. And there were things that I needed. And because I was very upset on the way home. And so there were, I think that I realized that I really needed to deal with my own feelings about the situation and probably needed to talk them out with someone who wasn't involved in the situation, with someone who was removed. But again, and I relayed the information to our supervisor, how well things went, and then went back with the, of course before the drive home, went back and told the chaplain how well I thought things worked out, and I very much appreciated his help and his input and the way we all worked together to accomplish the same, even though we had different jobs, we accomplished the same purpose, and that was helping that family in that time.
And are there any things that you might do differently in the future as a result of this incident?
I probably would have asked the chaplain to sit down and talk with me when the shift was over, or to have or maybe even a different chaplain, a day shift chaplain, that I could have talked to and kind of sorted out some of the feelings so that I could go home and sleep.
Right. And then what issues arose out of this reflection that you would take back to a supervisor?
Definitely that I think some kind of processing of a very critical incident is not only desirable but probably even mandatory. I mean, you can't continue to give the best of yourself if you haven't taken care of yourself, and that was probably one of the key things that I learned from that.
Okay. Well, thank you very much for coming in today. Greatly appreciate it.
Thank you.
Well, I hope that you enjoyed my example of critical incident analysis. I hope that you were able to learn that this teaching and learning strategy can be helpful in a job interview situation, along with many other clinical situations such as code debriefing. After watching this, hopefully you find that critical incident analysis can be very helpful in future situations. And thank you very much for watching.